Hello, everyone, and welcome back to another insightful episode of MedSynapse podcast series, where we bring together medical innovations and real-world insights from leaders shaping the future of healthcare. And today, we are diving into a transformative conversation, which is integrating advanced radiotherapy and holistic care, its technology, patient centricity, and the next decade of oncology. As cancer care continues to evolve with precision technologies like IMRT, IGRT, and proton therapy, one crucial question remains: how do we ensure that compassion and connection stay at the heart of this high tech journey? And to decode this today, we are joined by someone who perfectly bridges the gap, Dr. Vivek Immanuel, who is an associate consultant and radiation oncologist with over 15 years of experience and with an MBBS, MD in radiation oncology and a national fellowship in palliative medicine. Doctor believes in treating every patient as if they were his own family, combining cutting-edge science with human empathy. So welcome, Doctor, and it is such a pleasure to have you here with me for this conversation today.
Thank you very much.
Doctor, could you start by sharing a bit about your journey in radiation oncology and what actually inspired you to bring together advanced technology and holistic care in your approach?
Okay. So very good afternoon to everybody at MedSynapse and all your viewers as well. I am Dr. Vivek Immanuel, and my journey in radiation oncology has started at about a decade ago, and I've been practicing medicine since about the last 15 years. So I started my journey at Christian Medical College in Ludhiana, and then gradually found my way in the heart of Delhi NCR at Max Saket, and from there I moved on to Fortis Memorial Research Institute in Gurgaon, where I've been here for about the last 4 years. So I started out with a deep fascination for radiation oncology because it shows us how physics, imaging and computation come together to make cancer treatment safer and smarter. So for those who do not know, and for others as well, radiotherapy is delivered with the help of high-end machines known as linear accelerators. So these machines produce very high energy X-rays which are targeted to the tumor-bearing areas of the body with the help of CT scan or MRI guidance. So over the years, working with multiple modalities like IMRT, IGRT and SBRT, it has taught me that precision has an immense power. But the turning point came when I started working with the MR-Linac here at Fortis Memorial. So this was the first system of the world which combines MRI imaging with the linear accelerator in real time. So this allows us to see the tumor as we treat it. So it helps us to adapt the radiation treatment in every fraction and personalize delivery on a daily basis. So this experience changed the way that I saw cancer care. Yet even the most advanced machines means very little without human connection. So I've seen how compassion, time spent in explaining the process of the treatment, and holistic care from nutrition to mental wellness all play a very profound effect on the patient outcomes. So for me, modern oncology is about precision guided by technology but powered by empathy. So that is where my journey has begun.
That's truly inspiring, and actually it's such rare to see a perfect balance of science, empathy together. So that's really interesting, Doctor. So now, Doctor, moving forward, radiotherapy has evolved so much from IMRT and IGRT to proton therapy and adaptive planning as well. So in your experience, which of these innovations has most significantly transformed patient outcomes in recent years?
So in radiation oncology, every decade has brought us a leap forward. But now I think we are in the era of adaptive radiotherapy, and particularly MRI-guided adaptive radiotherapy. So this MR-Linac has changed how we thought about precision. So unlike the previous techniques, this techniques helps us to visualize the tumor and the surrounding normal tissues around the tumor in real time. So it helps us to replan the radiation dose on the spot in case if there is any change in the anatomy of that patient. So that means what we deliver today is exactly tailored to that patient's daily anatomy. This reduces the toxicity, improves the tumor control, and gives us the confidence to escalate these doses safely, especially in cases of prostate cancer, pancreatic tumors, and even brain tumors as well. So the combination of this functional MRI imaging and the capability of on-table adaptation represents the biggest leap since the advent of IMRT, and it is taking radiation from being a geometry-driven treatment to being a biology-driven treatment now.
Yeah, I think that's so fascinating, especially how precision has advanced so much over the years. So it's really interesting. So now, doctor, as radiotherapy becomes more sophisticated, there's often a risk of it being feeling impersonal as well. So how do you ensure that patient experience remains compassionate and individualized even as technology takes center stage?
So that is a very important question. So while technology has revolutionized what we can do, but compassion is what determines how the patients feel about what we do.
Yes.
So here, especially at Fortis, what we've made it a practice to ensure that every patient understands their journey. We show them their MRI images. We explain to them how the adaptive treatment works and how it is personalized for them. So when the patient feels informed and involved, his anxiety decreases and the compliance with treatment also increases. And even simple gestures matter a lot. For example, checking in before each radiation session and remembering small details about their lives and making the environment a little less intimidating really helps. So precision should never dehumanize care. In fact, it should free up more time for human connection. So the philosophy is simple: treat the tumor with technology, but heal the person with empathy.
Yeah, that's such a good phrase to imply as the doctor also, and it also should. A lot of doctors would take that from that one sentence, I think. So now, doctor, important is shared decision making in radiation oncology, and what strategies can make this process more inclusive for patients as well as their families?
So shared decision making is essential, especially because we are in an era where a patient has multiple options. So from IMRT to IGRT, SPRT, MR guided therapies and combinations with chemotherapy and immunotherapy, patients are more informed than they've ever been. However, that is a good thing. Practically, I believe maybe visual communication is the most important. We need to show the patient their scans, their PET scan images, explain to them the trade-offs between the different treatment techniques, and discuss both the oncological outcome but also discuss the quality of life which is expected. So it is also very important to involve the family members early on during the course of treatment. So the shared decision making isn't just about choosing a technique. It's also about aligning the treatment with the patient's values, their fears and their goals. Because when that happens, the patient feels more empowered. They tend to trust the team and they engage actively in their own recovery.
Correct. And I actually love that involving patients, families also often changes the entire outlook on their outlook also on their treatment. So it's really interesting. So now, doctor, in many resource-limited settings, especially in countries like India, access to cutting-edge radiotherapy remains a huge challenge. So what practical steps can healthcare systems or policymakers take to bridge this technology access gap?
So that is one of the biggest challenges in oncology today, especially in India. But I believe the solution to this lies in scalable innovation and collaboration. So not every center needs a high-end MR Linac, but the philosophy of image-guided patient-centric care can be scaled. For example, there are options of cloud-based computing, centralized treatment planning hubs, and even virtual tumor boards, which can allow smaller centers to benefit from tertiary level inputs. And maybe training programs, maybe remote mentoring and open access clinical protocols can ensure that even resource-limited centers can deliver evidence-based high precision care. Because ultimately the goal of technology is to make things more inclusive rather than exclusive.
Correct. And I think that's, again, very insightful sharing that you've shared with us right now. And I think that's such a realistic take as well. So thank you for sharing that. So doctor, now moving forward, if you could envision the future of oncology care from a decade now, so what would be an ideal patient-centric radiotherapy ecosystem look like to you? Like, I would say this question is like really interesting to know because how much it has changed over the years and what else is to come, like what the future still holds?
10 years from now, I think oncology will look radically different. So I see maybe an ecosystem where artificial intelligence, imaging, and biology converge together, where radiation planning is automated, but treatment responses are being predicted in real time. And the treatment adapts continuously to the patient's biology as well. So I think maybe radiation will become more of smart therapy, guided by advanced imaging techniques, informed by radiomics, and personalized through genomics as well. But alongside that digital sophistication, I believe the most successful hospitals will be those which retain their humanity. We might see shorter, hypofractionated adaptive treatments, but they should be integrated with psychological support, nutrition, and rehabilitation as well. So, oncology teams should maybe aim to become wellness teams, and survival should be defined not just by the years which are being added, but the quality which is being restored to those years. So that is the future I want to help to build, a future where technology refines precision, but the compassion defines the care.
Yeah, I think that's such a hopeful and forward-looking vision also. And I think it really highlights and couples with how empathy and innovation can go hand in hand again.
Yes.
So, Doctor, thank you so much for sharing your insights as we wrap up today's session. And this conversation actually beautifully captured how technology in oncology and compassion should work together and actually can redefine cancer treatment. So, thank you so much for sharing that.
Thank you very much for having me on. And it's lovely to see the work that is being done on MedSynapse. And I'm glad I was able to be a part of it.
Sure, Doctor. Thank you so much. And we look forward for more insightful discussions together.
Definitely.
And to our listeners, thank you for tuning into this episode. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay updated and keep learning in this field.